I've been on a lot of mission trips. I've worked with a lot of people. I've never worked with an organization like RAM. I'm Dr. Chris Sawyer. I'm RAM Medical Director. I was in primary care for 35 years, and I've been with RAM since 2010. When I started with RAM, operations were held in a little school, and for our first board meeting, I was warned not to go into certain rooms or I'd fall through the floor, and to watch out for the raccoons. A medical clinic consisted of a bunch of guys throwing some money in the pot, going to a location, take what we had, and set up a medical clinic. In 15 years, the growth has been unbelievable. Look around and look at the logistics of what we can do now. The patient shows up and gets that coveted number. They come into a bank of computer operators, all volunteers. They're triaged. They eventually come to medical. The problem is assessed. Practitioners like myself go in and evaluate the problem. We can take care of the problem, may have to fit the patient into chronic care, may have to do a procedure, and we may see hundreds of people doing this. If we're lucky, specialists join us, but usually it's primary care, and we get them the care they need all free. May work 12 hours a day for 2 or 3 days, seeing patients. We have the RAM teams come over the day before a clinic. If you look around, there's a lot of work putting up curtains and setting up equipment that is done before the doctors get here. When the doctors and practitioners get here, it's ready to go. Lists of medicines, equipment, everything is in place, and it makes it very simple to go in and practice medicine. The patient is triaged, the nurses have the problem on the chart. All I have to do is walk into the room. I'll talk to the patient, assess what their biggest complaint is, and see if I can reasonably take care of that here today. It was amazing what we could do on hardly anything, but it was because of the volunteers. Everybody helping, everybody throwing a little bit into the pot. When money started coming in a little bit better after the 60 Minutes interview, we were able to expand. We were able to offer more. We now will probably do 200 clinics this year. We provide millions of dollars of free care. It's the best use of money that I've ever seen in an organization. It's amazing what these guys do with the donations we have. We do not get government money, but yet we have the logistics and the hierarchy to pull this off, clinic after clinic, sometimes 3 in a weekend, and see tons of patients, attract volunteers that wouldn't come back if it was a funny operation. And every year it grows more and more. If we had the funds, I think that we could see thousands and thousands and thousands of people. We're limited by what we have at RAM. We're limited by the space we have and the clinics that we do, but we're expanding every year, and we need the funds to keep expanding. Medical, as I told you before, we treat everything else, but all three work as one team. We're not RAM, they're not RAM, we're all RAM. The complete services that we provide really make for a good experience.